Why your tongue is white. Well, hey guys, in today's video, we're going to be covering 5 causes of a white tongue. In no particular order, number 1 is something called geographic tongue or benign migratory glossitis. Basically, you have little pink smooth patches outlined in white. This is something that is not dangerous. As the name implies, it is benign, meaning it's not cancerous. It affects maybe roughly 3% of the population. We truly do not know what causes this, and it can be somewhat symptomatic, meaning when you eat things that are spicy, hot, or really acidic, it can burn your tongue, be very uncomfortable, but otherwise it doesn't typically bother people. They don't even notice it unless they happen to look in the mirror or someone points it out, because you know, if there's something going on with your skin, anything visible, there's always going to be that one person that has to point it out. While we don't know what causes geographic tongue, it often occurs in association with a handful of other conditions, including psoriasis, allergic contact dermatitis, atopic dermatitis, asthma, reactive arthritis, and it's often seen in the early stages of type 1 diabetes. It'll come out of nowhere all of a sudden, usually lasts several months. It may go away, but it often recurs. A lot of people who have geographic tongue, they have a family history of it. So again, you can always point to your genetics when there's something going on. Because it's not dangerous, there are no complications, you don't need to treat it. However, because it can be uncomfortable, there are a variety of treatment options your doctor might offer to provide some symptomatic relief, such as a topical anesthetic to help numb the tongue and take away that pain, as well as avoiding triggers like eating spicy foods or really sour things. Number 2 is oral candidiasis, otherwise known commonly as thrush. Candida yeast naturally lives in our mouth. It is a natural part of the microbiome in your mouth. However, when it increases in number due to underlying issues, which we'll get into in a moment, it can kind of take over, and it can take over the tongue. Also, for some people, it might even cause problems at the corners of the mouth. With oral candidiasis, you have white patches that can happen not only on the tongue, but also the gums, the sides of the mouth. These white patches might scrape off and be very tender underneath. When somebody develops thrush, it's usually secondary to an underlying condition or being at an extreme of age. For example, we might see it in an infant whose immune system is still developing, or we might see it in a much older adult whose immune system is, well, aging. People who have serious illnesses such as cancers, medical problems where there is an issue with the immune system, or HIV are predisposed to getting thrush. You can also see thrush developing in patients who have to use steroid medicines that you inhale. Let me know in the comments if you've ever taken antibiotics for a prolonged period of time and developed a yeast infection. Not fun. Well, in the mouth, you can also get thrush, oral candidiasis, more or less the same thing. So taking antibiotics does put you at risk for a bout of thrush. Patients who have an underlying nutrient deficiency also can get thrush. Certain medications can cause your mouth to be dry, or you may have an underlying medical condition called Sjogren's syndrome that leads to dry mouth. The dry mouth, the decrease in saliva, it can change the makeup of the microbiome in your mouth, favoring more Candida yeast and the development of thrush. And of course, nothing suppresses the immune system like a cigarette, like tobacco, like smoking. So smoking, vaping, chewing tobacco does put you at risk for thrush. In addition to treating the underlying associated condition, making sure it is well controlled, removing any lifestyle habits that contribute to this, oral thrush can easily be treated with an antifungal, either one that you put in your mouth and swish around, or one that you take by mouth. Reason number 3, leukoplakia. Leukoplakia is concerning because it is a finding of early stage squamous cell carcinoma in the mouth. Squamous cell carcinoma in situ, meaning it is just confined to the epidermis and hasn't spread elsewhere. It can be homogeneous, white, and uniform in color, almost take on a leathery texture with time. Or it can be non-homogeneous in appearance, meaning kind of white with redness surrounding it. That's referred to as erythroleukoplakia. Smoking is a huge risk factor for leukoplakia, 6 times the risk. It appears usually on the sides of the tongue, but it also can happen underneath the tongue, inside the mouth, on the sides of the mouth, along the gums, This is identified clinically by looking inside your mouth. When we see it, it means you need a biopsy to confirm that it is leukoplakia. Biopsy will also assess to see if there is any associated cancerous changes, and then treatment is recommended accordingly. Telling you guys, do not smoke. These are some of the things you might have to deal with if you do. Number 4 is oral lichen planus. Lichen planus, I have a whole video about. This is a chronic inflammatory skin condition that can affect the mucosal membranes. It's related to the immune system coming in and attacking certain things in a specific way. Presents with this characteristic white lacy scale, but it happens inside the mouth and it can happen on your tongue. You get this white lacy-like pattern. It's referred to as reticulated. Oral lichen planus is no joke. It can be super painful. It can ulcerate, create these sores on the tongue. It can make it very difficult for patients to eat. They end up losing a lot of weight, can develop nutrient deficiencies if it's not treated. Treating oral lichen planus requires the patient to be so meticulous about their oral hygiene. That includes flossing, brushing the teeth twice a day. If you smoke, you have to stop that because it will make this much worse. And there are a lot of treatment options to control the inflammation in the mouth and get this to go away. For example, there is a medication called tacrolimus. You can take it, it's a pill that you can put in some water, let it dissolve. You swish that around in your mouth like a mouthwash, and then you spit it out. It can help control this condition just by delivering the medication locally within the mouth. There's also steroid medications to calm down the inflammation that leads to this problem, either that you take by mouth or that you just apply to the area. And of course, there are medications that you take by mouth that lower the immune response, such as cyclosporin, methotrexate. And last but not least, you actually can develop psoriasis on your tongue. So this is not very common, but it definitely can happen. Psoriasis is a chronic inflammatory skin condition. Usually you have these well-defined plaques, raised areas of thickened skin, usually bilaterally symmetrical on extensor surfaces of the skin like the elbows, the knees. Also commonly affects the area right above your gluteal crease, the scalp, behind the ears. It loves the skin fold. Now, one thing I want you guys to know about psoriasis is that it's not just a skin disorder. It is a chronic inflammatory condition. There are so many other things that come along with it that unfortunately oftentimes go unmonitored because of lack of awareness. For example, patients with psoriasis can go on to develop a very debilitating arthritis. It's important to pay attention to how your joints feel. If you have morning stiffness, bring that to the attention of your healthcare provider right away. A lot of times the psoriasis can attack the tendons and places where the tendons insert. It's called an enthesitis. So for example, your heels. Heel pain is a sneaky little clue of psoriatic arthritis. So the tongue is one part of it, but it's a whole body condition. The other thing about psoriasis is that it can have a strong association with a risk for cardiometabolic abnormalities, meaning having obesity, having heart disease, having problems with your lipids, and having type 2 diabetes. And so all of those things go together. And it's like those things plus the psoriasis, and they kind of feed off of one another because they're all inflammatory conditions. And then another big thing about psoriasis that not many people talk about, but is really something that dermatologists know firsthand because we see a lot of psoriasis patients, is that psoriasis really can have a significant emotional component to it. A lot of patients with psoriasis have underlying mental health disorders, depression, anxiety. So if you are feeling down and you have psoriasis, please understand that this is not uncommon and it is related to psoriasis. Strongly advocating for mental health in psoriasis, I mean for everyone, but for psoriasis in particular, because there are, again, things that patients with psoriasis have that just go unmonitored, undetected. And you know, if your doctor is not actively asking you these things, you may hold back, you may refrain on speaking up for yourself because you're like, oh, I'm here for my psoriasis. But guess what? Your mental health is your psoriasis. They're part of the same process. They're part of the same thing. They really impact one another closely, because when your mental health is suffering, that causes you a lot of emotional stress, and the emotional stress actually flares up the psoriasis. So while you may have something going on in your tongue, what I want you guys to understand is if you have psoriasis, there's a lot more to it than the skin. All right, y'all, those are 5 reasons why you might have a white tongue. Recently, I reacted to a guy on TikTok who's really into tongue scraping. So should you go out and buy a tongue scraper? Will it help with having white tongue? Depending on what the cause is, it may not do anything. However, in the case of lichen planus and psoriasis, that trauma to the tongue can actually aggravate the condition. So be really careful with the tongue scraping thing. You know, tongue scraping may help to improve halitosis, which is a fancy medical term for bad breath, just by getting rid of some buildup on the tongue surface that, you know, would get broken down and by bacteria and cause bad breath. But it's not medically necessary. It's not necessary for good oral hygiene and for the maintenance of the health of your oral cavity. It's a popular trend, a remedy, but again, you want to be careful to know what it is exactly that is causing your white tongue before you go pursuing something like tongue scraping. In the case of thrush, scraping the tongue is not going to get rid of the Candida yeast. In the case of geographic tongue, scraping your tongue is not going to do anything to get rid of your tendency to have geographic tongue, unfortunately. But regardless of if you have white tongue or not, I cannot emphasize enough how important good oral hygiene is, and that includes flossing twice a day, brushing your teeth twice a day, and regular dental visits for a dental cleaning. Super important. I get a lot of comments on here about aging and the aging face. Oral hygiene is something you can proactively do to not necessarily prevent facial aging, but when you have poor oral hygiene, it compromises your teeth and the bones in your jaw, and you can get a lot of bone loss as a result. And guess what? That really can age your face quite a bit. So take good care of your teeth, not to mention you need them to last a really, really long time, because you're gonna be here for a really, really long time. All right, y'all, enough of me rambling. I hope you guys enjoyed this video. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.